This is Applied Pharmacology Chapter 13. We're going to be talking about antiparasitics. Now, there are a lot of antiparasitics out there, and there are more being developed every day. And they're going to change in the way that they're delivered, so the delivery system of different insecticides. But if we know the ingredients that are found in common anthelmintics and insecticides, it's going to help us to understand what the product does and understand the product labels so that we can identify these different classes and understand the contraindications for each class. So some key terms: anthelmintic means to kill worms. Bots are larvae, usually larger larvae. Cestodes are not flatworms, but tapeworms. Ectoparasite versus endoparasite, so an outside parasite versus an inside parasite. Helminths are worms. Microfilaria are baby worms, or the larval stage of worms, of the more larval stage of worms. Nematodes are roundworms. Organophosphate is a indirect acting cholinergic. Parasitiasis versus parasitosis, how it affects the animal that has the parasite. Symbiosis is a parasite that works together with a host to provide good things. And then a trematode is a flatworm. Parasites live a symbiotic life in that they live at the expense of another. Sometimes that symbiotic life is helpful to another, and a lot of times, especially with parasitosis, it's potentially pathogenic. Okay, so if an animal harbors the potentially pathogenic parasite but shows no clinical signs, this is known as parasitiasis. If it lives with, if an animal harbors the parasite that causes injury, that's known as parasitosis. So parasitiasis means we're living together in harmony. Parasitosis means I'm getting sick from it. Endoparasites are inside the body, and we call that infected with endoparasites. Ectoparasites outside the body are infested with ectoparasites. So infested with fleas, infected with roundworms. We need to know species names, life cycles, and zoonotic potentials of parasites, so that's really important. Some specific ones for all of our animals would be Toxoplasma gondii, mostly affecting cats, Trichinella spiralis, or trichinosis, mostly affecting pork, Antiparasitics affects a lot of different species, but dogs. Toxocara canis is a roundworm that affects dogs as well. So you need to remember these. If you're having difficulty remember these, this is chapter 14 of Mir Kernan's book. You can actually go back to the lecture that I recorded on the YouTube channel to check that out. Fecal centrifugation is the gold standard for accurately diagnosing endoparasitism and should be tested at least 1 gram of feces. So that's a small amount of feces. This is about to scale, okay? Small amount of feces that we put in a centrifuge tube, fill it up with fecal sol solution, spin it down so all of the heavier stuff down at the bottom and the lighter stuff, like eggs that have water on them, are up at the top. And we fill that further with water and put a glass slide on it, and all these eggs float to the top. And that's how we further concentrate the eggs away from the debris in the feces. All right, antinematodal. First drug class, benzimidols or bendazols. These interfere with cellular energy, so they make the cells in the worms very, very tired. We use this a lot in larger animals, dogs, and exotics. They get strongyles, so roundworms, pinworms, ascarids, trematodes, which are flatworms, tapeworms, cestodes, hookworms, roundworms, and whipworms. So a lot of different things. Adverse effects are uncommon, but could include vomiting and diarrhea. So what is a common bendazole? Fenbendazole. Anybody know what that's commonly called? I'm going to ask you in class, so you should look that up. What is fenbendazole called? Okay. Organophosphates. These inactivate acetylcholinesterase. right? These are indirect acting cholinergic drugs, and they paralyze the worms. They affect the horse, or they are used in horse, cow, sheep, goats, dogs, and cats and swine, but dose dependent. They can cause some adverse effects like sludge effects, salivation, lacrimation, urination, diarrhea, GI upset, and emesis, because they're indirect acting cholinergics. So they're going to cause some of these parasympathetic effects. They treat bots, roundworms, strongyles, pinworms, hookworms, roundworms, whipworms, ascarids, and nodule worms. An example, there are a lot of, this is kind of an older medication. There are a lot of these out there that we use, but cats can be specifically very affected by it. We do have to be very careful with the dose that we give cats. Do you remember what the antidote is for organophosphates? They're an indirect acting acetylcholine drug. So if it's a cholinergic, our antidote is going to be something like an anticholinergic. So atropine or pralidoxine. Okay? So you have to put these connections together as you go through these. Tetrahydropyrimidines, used in large animals, dogs, cats, and swine. Strongyles, pinworms, hookworms, and roundworms. Not a lot of different worms. We don't use it often, but they don't have a lot of side effects. So some increased respiration, sweating, and incoordination. Imidazothiazoles. These are used in large animals, dogs, cats, and exotics. They get kind of the roundworms, ascarids, and strongyles, lungworms, hookworms, which are roundworms, ascarids are roundworms, strongyles are roundworms, whipworms are roundworms. Adverse effects would be transient foaming at the mouth, usually due to a bitter taste. Ivermectins, one of the biggest class of antiparasites or antinematodals. These interfere with the nervous system and the muscle function in parasites. They affect the glutamate-gated chloride channels, and these channels don't exist in mammals, so they're safer for mammals. So we do see some uncommon adverse effects if we have large doses of ivermectin, especially. We can see some nervous system disorders and some transient blindness, things like mydriasis, ataxia, tremors, and depression. But it's pretty unusual unless you're using higher doses. Horse, cow, dogs, cats, swine, birds, snakes, we've used ivermectin on all of them. Moxidectin is a type of ivermectin that we see used in, trying to think of I use it on my cats. Anyway, so the topical stuff that you use on your cat. So horses, cattle, and dogs. Not cats. Strongyles, pinworms, encysted cyathostomes. So if something is in a cyst in the muscle, it's much harder to get to. Ivermectins will get to it. Hairworms, threadworms, largemouth stomach worms, bots, hookworms, heartworm, ectoparasites like lice, grubs, mites, hornflies. Off-label, we can use it for ear mites, scabies, and demodex as well. Piperazine is used for dogs, cats, exotics, and sometimes in combinations for large animals, and it gets roundworms with uncommon adverse effects. Praziquantel or parental and fibental. This is called Drontal Plus. Anything with praziquantel is for tapeworms or cestodes. Okay. If we use it in combination with other things, it will get hookworms, roundworms, and whipworms. Don't use Drontal Plus commonly, especially in dogs smaller than a pound or less than 3 weeks of age. We're going to see Drontal Plus used actually more often in cats. Scolaban or bunamide, we can use in dogs, cats, and it's safe with pregnant animals. You might see some vomiting, anorexia, diarrhea, and lethargy. I can get some of these tapeworms, Echinococcus granulosus, multilocularis, this tapeworm, Tinea pisciformis, Diploidium caninum, and cats, Diploidium caninum, and Tinea formis. So these are all tapeworms. These are anticestotal, see anticestotal, and this is scoloban. Cestex, epsiprantal, and praziquantel droncit are used both in dogs and cats, and this gets the tapeworms in these animals. So uncommon to see any adverse effects. These are for flatworms, lungworms, flukes. Curatrem, valbazen, and droncit. So albendazole, which is a bendazole, chlorsulon, and praziquantel. So these are used in other animals, and typically it's praziquantel we use for lung flukes in dogs and cats. Profender is a topical solution we can use in cats that can help with hookworms, roundworms, and tapeworms, and it can be applied every 30 days. It's amodepside with praziquantel. Some antiprotozoans, things that we use for treatment for coccidia or other protozoa: monensin for turkeys and chickens, amprolium, clopidol, diclazuril, I won't even say this one, I don't use it, dequinate, panazuril, naracin, robenidine, and then the one that you are most often going to use, sulfadimethoxine, called Albon. This gets coccidia in chickens, turkeys, dogs, and cats. So there are ones to remember in here, like panazuril, diclazuril, amprolium, and monensin, but the one you're going to see most often in small animal medicine will be Albon or sulfadimethoxine. You just need to remember that's a sulfa drug. For Giardia, I'm sure you see plenty of Giardia in your clinicals. Sometimes we will use the combination of a number of different drugs. You can use albendazole or fenbendazole or Panacur, which is that fenbendazole. We can use metronidazole, which is also known as Flagyl. Treat dogs and cats for Giardia. Giardia vaccine is not super effective. So sometimes we can use it for prevention, but it's not super effective. Can cause vomiting, diarrhea, and occasionally nervous system disorders. For babesia, which causes anemia, we could use imidocarb, which is for dogs, and we use injections over 2 weeks, but it can cause some pain and some mild cholinergic signs, so sludge. For heartworm disease, we're going to use melarsamine, which is an imidacide. It is an arsenic compound. If you've ever, it's a poison. Okay, so in this case, we are poisoning the adult worms. We can get some pain and swelling and tenderness at the injection site, coughing, gagging, depression, lethargy, anorexia, fever, lung congestion, and vomiting. We do have to be very careful as we are killing the worms for 2 reasons. One, killing the worms will cause the animal to have, it can cause the animal to have an anaphylactic response. So anaphylaxis is an issue when we're killing a large amount of worms because of the proteins that are coming off as the animals are dying. The second thing is these worms, as they're dying, can form into this big group, and it can cause a clot or an ischemic episode in the lungs or in the tissue and cause the animal to die. So melarsamine is an arsenic compound. We have to give it very precisely. It's a very narrow margin of safety. Ivermectin, milbemycin, and levamisole, these are all ivermectins and avermectin. Milbemycin is a macrolide. This is something that kills the bacteria as well. And levamisole is an imidazothiazole. So these are all microfilariacides. They kill babies. And they can be used 6 weeks after the adulticide, although the Heartworm Association is now recommending that we start those right away. I have, there's a table 1310 in your book for heartworm prevention products. You must be familiar with all aspects of those products. If you are not, you're not going to do really well in educating your clients. So that, and I'm going to test you on it. So be familiar with table 1310 in your book. Ectoparasites. Ectoparasites are everywhere. That means they're ubiquitous. They are difficult to control. The environment, indoor and outdoor, and geographical location affects the incidence of ectoparasites. Table 1311 has a comparison of various products that are available for reducing this and preventing ectoparasites from infesting, not infecting, but infesting your animals. There are so how do we apply them? Pre-diluted sprays are convenient and available for use in the animal, on the animal or environment, usually water or alcohol based. The pet must be sprayed from head to tail, and some sprays are toxic to certain species and certain ages. So we have to be very careful to read the label, especially with cats and permethrins. Emulsifiable concentrates. These are dips, yards, and kennel sprays. They must be diluted with water. Dips are to be used after a shampoo, and the products usually have a residual effect, so you have to leave it on them. Do not rinse them. You never, ever, ever want to use an organophosphate dip on a cat. It will become toxic to them. And these are, these can be toxic. It depends on the product. You must read the label. These are dangerous. Okay, danger. They're concentrated. Okay, these are also can be dangerous. Okay, shampoos could be simply to clean the coat of ectoparasites. Because they're shampoos, they have to be rinsed. They're going to cause skin irritation if not. So they have no residual effect whatsoever. So you can use them, and they might help to clean the coat of ectoparasites, but then you have to use a flea comb, or you have to pick the nits off, etc., etc. So they are not, I do not recommend shampoos. They're not helpful. Foggers. Foggers work best in large open rooms that you have already vacuumed all the corners of and any crevice and thrown away the vacuum cleaner bag or rinsed out the canister. They don't get into small spaces very well or under objects. So if you have it in a room that has a couch, it's not going to get under the couch. You have to be careful of fish tanks, birds, any animals that are inside the house, and remove them from the house and the kids until the product is dry. Once it's dry, it should be safe. All right, so some monthly flea and tick products. These are typically safer to put on your pet. Fipronil is frontline. You can use it in dogs or cats, controls low-level flea infestations up to months, and ticks up to 1 month. We can have a hypersensitivity or irritation at the site. We do not want to bathe the pet often because that decreases the efficacy of the medication. Advantage is imidacloprid. Dogs, cats, and rabbits can have the small cat. This is the only one that we can give to rabbits. It's not absorbed in the bloodstream, unlike most people think. It controls low-level flea issues, and we don't often see many side effects. If we're using Advantix, canine Advantix has permethrin in it, which cats are susceptible to, so we only use it in dogs. Gets ticks, fleas, and mosquitoes. We don't have many problems with it. Lufenuron is a tablet or injection for cats. This is an oral thing. If we add it to milbamycin, we get the product called Sentinel. It's oral. It has monthly flea control. It can be injectable for cats, which is a 6-month flea control. What it does is it controls the flea development. So a flea must bite the animal. It does not kill an adult flea. The flea must bite the animal, and then it will make it unable to reproduce. If an animal has a flea bite hypersensitivity, this is not the product to use. Promaris or metaflumazone is for cats and dogs. It's a topical product for fleas. If we use it with amitraz, it can prevent fleas and ticks, but we only use that with dogs. Do not give dog products to cats. Permethrin, this is for dogs, and this is the stuff that you find at Walmart. I mean, we find a lot of these at Walmart, but this is the one that most people get, okay? This is why we have problems with cats, because people that go to Walmart are getting this Defend X-Bot and it's labeled only for dogs. It helps with flea and tick control, and if we add Sentinel to it, we need to test for heartworm first. We do see some skin sensitivity and lethargy. We do not want to bathe them if they have this product on, and we do not want to use it for cats. The good thing is it's not very expensive. Okay. Selamectin is Revolution. I was thinking it was moxidectin, but that's not what it was. Revolution is for dogs and cats, kills adult fleas and also prevents flea eggs from hatching. It prevents heartworm disease, ear mites, hookworms, and roundworms in cats. And so this is something that I have my own cats on because they're outside, and I give it to them monthly because I do not want them to get heartworm disease. I also don't want them to have fleas. We can see some localized alopecia or irritation at the application sites of some treated cats. Animal must be dry before we put it on, and we do want to do a heartworm test, especially on dogs, before we apply it. Comfortis is an oral medication for dogs. Give it as a monthly tablet for fleas. It can cause vomiting and seizures. Some other insecticides, these are active ingredients. Okay. Pyrethrins are from chrysanthemums. They're safe for most mammals. They have a quick kill and low residuals. They're always used as synergists with other insecticides. Okay. Synthetic pyrethroids are synthesized chemical that are similar to pyrethrins. They're pyrethrin-like. So they have the same things, but they are dangerous for cats. We don't always need a synergist as well when we're using these pyrethroids. Chlorinated hydrocarbons, this is a DDT. This is banned from use because it's unstable. It is hazardous. Carbamates, cholinesterase inhibitors. These should not be used with other cholinesterase inhibitors, phenothiazine derivatives, or succinylcholine. They are going to cause our sludge side effects that we see with the parasympathetic nervous system. So salivation, lacrimation, vomiting, diarrhea, gastrointestinal, and in addition, we'll see muscle tremors and meiosis, or a constriction of the pupil. Organophosphates, OP, okay, same thing as a cholinesterase inhibitor. Same thing. The antidotes are atropine and 2-PAM or pralidoxone. Same thing. See the same thing here. These two are basically the same. Formamidines, it's Amitraz. It's not an OP. This is what we use. It's Mitaban or Preventic. Can cause sedation, low temperature, increased blood glucose, and seizures. Do have to be careful with this with cats. Capstar, much better than a shampoo. This is a neonicotinoid, so it will kill adult fleas and other insects like bees in 30 minutes. It's safe for pregnant and nursing animals. It is safer than dips and shampoos. Synergists like piperonil increase the efficacy of pyrethrins and some pyrethroids. So most times pyrethroids don't need piperonil, but some do. If we're adding it, it is toxic to cats. Repellents, it's great to use repellents. Sometimes we'll have repellents that we use or horses use, or sometimes our companion animal products to repel gnats, mosquitoes, flies, and combined with pyrethrins and pyrethroids, they will repel fleas and ticks longer than the active ingredient alone. Insect growth regulator hormones interrupt the natural development of flea larvae, and these are things that we will see put into dips and foggers and environmental sprays to prolong that activity so that they will last for 3 weeks or longer. So others, rotenone is toxic to fish and swine, so we have to be careful of that. D-limonene is an extract of the citrus pill. This is why citronella works. It has a quick kill, but it's not residual. Ivermectin is a systemic, and we can use it topically as a systemic as well. Benzyl benzoate kills a lot of ectoparasites. It's often combined with other things. Petroleum distillate is added as a solvent for pyrethrin and pyrethroid products. That's the end of our antiparasitic medications. Again, there are a lot of categories to go through and a lot of things to remember. I would start with the things that you recognize and then grow your knowledge from there.